And I want to give you some practical guidelines for those of you who just had a C-section. So if it was planned, it's usually spinal anesthesia. If it was unplanned, probably epidural. And after you're delivered, you are in your recovery room for a few hours and then to your postpartum room. At some point, your nurse is going to get you out and about. Ambulation, sooner the better. 5 to 10 minutes, 4 times a day is going to really help you to minimize the risk of blood clot and also help your GI to kind of go back. Also, we don't go from clear liquid to regular diet. We go straight to regular diet so that your bowel function goes back quickly. It is interesting, only when one is admitted to the hospital do we ask you, have you passed your gas? Have you had a bowel movement? No other time. We are so interested, have you passed your gas? Well, some people even recommend chewing gum for 15 minutes, 3 times a day until you pass your gas. But ambulation and regular diet as soon as possible is very important. As far as pain medication is concerned, so many of you are concerned that taking narcotic may affect breastfeeding and your newborn. Well, aside from Motrin and Tylenol, medication like oxycodone is very safe. If you're walking around the room with a hunch, then you're not taking enough pain medication. You want to be able to walk with normal posture. So you want to alternate between Motrin, Tylenol, and here and there, take oxycodone. It's not going to affect your little one. It's going to make you feel better. Pain is very hard to catch up. And as soon as possible, maybe after a day, take shower. And usually after 4 nights, some of you may want to go home after 3 nights. You go home, and the question becomes, how much can I lift? Well, you can definitely lift your newborn. And I think lifting up to 20 pounds is very reasonable. Can you climb stairs? Absolutely. Most of you are young and healthy, and it really is not going to be a problem. How about driving? Can you drive? I'm not really sure where this started, but after major abdominal surgeries, including cesarean section, we say no driving for 10 to 14 days. I'm not really sure why that is. Hypothetically, I see where if you hit your brake really suddenly and hard, I could see how perhaps that increase in abdominal pressure could open up the stitch. But you know what? In 30-some years, I've never had a case. So I think it's more important that you're not taking any narcotic before you drive. So what I tell patients is that once you go home, you can climb stairs, you can pick up your newborn. If you have other kids up to 20 pounds, I think lifting that other child will be fine. And take plenty of pain medications and try to get back to your normal routine as soon as possible. After 2 weeks, some people have done so well, they want to say, can I exercise? Well, sure. And if you want to do that, then start with maybe short walk to long walk to type of exercise that you are used to. I even have a patient who I think after 3 weeks, she wanted to know if she could do Peloton. I said, sure. If you want to sit on a Peloton and bike and you feel fine, why not? As far as using bathtub or going swimming, as if your bleeding stops completely, then you may use your bathtub or go swimming. Summer's here. So common sense rules, and you just had a major surgery, and sooner you get back to your usual routine, faster the recovery.